Neoplasms. All right. So that goes from what? 140 to what?
239.
To 239. Huh. Are you beginning to see how the book breaks down? So if it's a neoplasm of the lung, what code number range do you know it has to come from? 140 to 239. If it's cancer of the stomach, what code range has it got to come from? 140 to 239. Gosh, do you see how if I knew all these ranges, how it would help me know if I was on the right track? Because if I had gotten an 800 code for that, I could say, oops, I know that's not right. Well, if 239 is the last of that series, what's the next code I'm looking for? 240. All right, and 240... No, it's not by page number. It's by code number.
I mean by code. It's like 39 or 38 or something. A range of 38 codes or 100.
It depends on the range of codes that have been assigned to a given category depend on how large that category was when they started. Yeah. All right, so endocrine makes up which codes? 240 to 279. All right, what's the next section? 280. And diseases of blood and blood forming, 280 to what codes? 289. Well, wait a minute, that's much smaller than some of the others, isn't it?
Yeah.
Oh. All right, so what's the next one? 290. You're on a roll here. And yes, we're going to do every one of them because I think it'll help you. All right, 290 to 319. So if you have a mental disorder, you are depressed, you have anxiety, you have panic attacks, what code do you know, what range of codes has it got to come from? 290 to 319. Exactly. All right, so the next code again? 320. And what's our range there? 320 to 389. And then 390 to what?
459.
That's a big one, kind of. And then 460 to 519. And then 520 to 579. You with us? Everybody okay? And then now 580 629. All right, then the next one would be 630. Is it 679? Maybe. They may have changed it in your book.
Yes.
Okay.
679.
All right. They've added 2 sets of codes since my book was published the year before. So 630 to 679. All right, 680.
709.
All right, 710.
739.
And then 740 to 759. Is it 759? Or is it 779?
759. Ours is 740 to 759. Yeah.
Okay, they've changed it again. That's fine. That's a problem with me not having a current book. All right, then 760 is what?
It's certain conditions originating in the perinatal period. 760 to 779.
Okay. 760 to 779. All right, and then symptoms and signs, 780 to
799.
799, and injury and poisoning,
800 to 999.
800 to 999. Do you remember me saying there were 999 sets of diagnosis codes, and that didn't include the V codes, and it didn't include the procedure codes? So every sickness, every reason for health care encounter has got to go into either one of these 999 codes, or it's got to go into the V codes, and we'll learn more about that as we go through. But let's look at this just a little bit. If the patient has had pneumonia, what range of codes do we know that must go into? Is it? 460 to 519, because that's respiratory. Not all pneumonia is infectious, is it?
No.
It's not.
But if it is pneumonia, would you not classify that under some parasitic disease?
It goes to respiratory.
Just strictly respiratory?
Remember what I said earlier? Everything's got one place it's supposed to go?
Okay.
All right. Now, if the patient has a heart attack, which chapter and range of codes do you think that would go to? 390 to 459. And let me go ahead and tell you that a heart attack code is a 410 code, so it's right in the middle of that. All right. The patient is a diabetic. Where would that go?
Would it be genourinary system? No.
Now, where did you study diabetes? In pathophysiology? Endocrine. Yep, it's endocrine. And it happens to be code 250, so it fits right in there. The patient is delivering a baby. What code range can we expect?
630 to 670.
Exactly, and if it's a normal spontaneous delivery, you're going to learn that's a code 650, so it fits right in there. That baby happens to be born, however, with a congenital heart defect. Where would that baby be coded? 740 to 759 for congenital. All right. The lady fractures her leg. Where would her fractured leg be coded? Be careful.
17 to 739.
Nervous system.
Fractured leg. Be careful. Read all of them.
800 to 999.
800 to 999. Why?
Injury.
Injuries. All right, so most of these are by body systems, but not all of them. All right? We've got mental disorders. That's not a body system. We've got pregnancy. That's kind of sort of a body system, but not necessarily. We've got congenital anomalies altogether. We've got symptoms, signs, and ill-defined conditions. That's when somebody has something that, well, let's back up. What is the difference in a sign and a symptom? Let's make sure you know that.
Sign can be seen sometimes.
Objective.
Yes.
And a symptom, it's very subjective. Symptom, subjective. Sign, objective. Sign can be measured. Whereas if I tell you my stomach hurts, is that a sign or a symptom? It's a symptom. If I throw up on the table, that's a sign. That's a sign. You got it. All right. And then injuries and poisoning. So every injury there is going to go between 800 and 999. Now let me try to, I know this is premature for you, but as I'm beginning to code and actually assign codes, and I have in front of me a patient who has had an injury, automatically what should pop into my mind is, aha, this has got to be a code from 800 or 900. Why? Because that's where the injuries are coded from. So if I happen to get a 400 code or a 300 code or a 200 code, should that begin to not feel right?
Yes.
Yes. So if I can get you to realize that as you start coding, you're going to find it's a lot easier. Now, there are going to be things in coding that I'm going to say to you, and you're going to think, what in the world is she talking about? But a little while later, this light bulb is going to go off in your head, and you're going to say, ah, now I know what she's talking about. It's just the way coding works, so don't beat yourself up over it.